Welcome to another episode of the Chronic Comeback podcast. This week, I'm really excited to have on the show Donna Mazzola. I'm really excited and honoured to have Donna on the show because Donna has the unique perspective of having a traditional medical background, but then also taking more of a functional, holistic view on things. But then also, which is like crucial to this podcast, having her own chronic health story and the issues and the suffering that comes with that. And we've only had one guest on the show that's had that unique perspective so far, and it was so interesting. We got a great response. I'm really excited to have you tell your story. It was actually Donna's own diagnosis in 2015 of Hashimoto's that caused her to look further afield than the traditional medical route, and becoming qualified in functional medicine only a few years later. After pioneering her own recovery, she now spends her time alongside her medical work, spreading her own knowledge on the functional side and helping others through her own brand, Dr. Autoimmune Girl. And yeah, I love the fact that we were just talking before the show came on that she's just got so many different plates spinning, and there's she's focusing on helping other people as well as launching her own, doing her own day job, etc., etc. So thank you so much for coming on and sparing the time. I know time's limited for you.
Absolutely. No, thank you for having me. I'm very excited.
Awesome. Cool. Well, if we could just go back to before like your diagnosis, I think there's an important part of the story where you were actually, how did you get into the medical side of things? I think you became a pharmacist and were very much, could you just talk us through that and then talk us through how you became ill and then that story?
Yeah, absolutely. So I, yes, exactly. Like you said, I went to pharmacy school and graduated back in 2006. And as my going through the learnings, I struggled with the fact that we primarily focus on medications for chronic diseases, where lifestyle, most medical guidelines cover lifestyle, but it's like a very small portion. And I always felt like there was such an imbalance between the two that we should at least be talking about them more in conjunction with each other, or even more focusing on the lifestyle, because so many of these diseases are preventative, but we don't talk about the fact that they are. And so that's one thing that stuck with me, and that was a big reason why I went into ambulatory medicine. I didn't like the hospital approach, at least here in the United States, because it was very much a bandage approach. And so people came in for a certain ailment, and then you fixed that, you bandaged it up, and you sent them out. Yet they still had a whole laundry list of other issues going on. So I thought to myself, okay, well, if I do ambulatory care, where I'm speaking with the patients on the outpatient setting, consulting them on their medications, I can incorporate that lifestyle factor into it. And I did that for about 8 years. And I think I helped a handful in that 8 years. But I was more or less extremely frustrated because, and I think I shared this with you, I had one conversation with a person that had diabetes that had no idea what carbohydrate was. And I think that was like the aha moment where I'm like, wow, we're failing these people. We're not even educating down to that level on the importance of lifestyle nutrition. And so, and then you end up these are all progressive diseases. And so like you could delay, maybe they do need to stay on an oral medication, and maybe they stay on that same medication for the next 15 years because you've educated them on lifestyle factors and nutrition, or you don't. And then in 5 years, they've maximized efforts. They've tried every medication they can't get under control. And that's really kind of like where we're at with this imbalance. So I did that for a while, got pretty frustrated, kind of started moving into more management, out of patient care world because of that reason. I didn't feel like I was providing the impact that I wanted to provide. And so it was 2015 when I was diagnosed personally with Hashimoto's, and discovering that now I had a chronic illness. And this is somebody who, like, I thought I was healthy. I ate right, whatever that meant. Right, I wasn't educated necessarily in nutrition. I was educated in medicine. And unfortunately, like I see a huge gap in our medical system and that we don't educate providers on nutrition. So a lot of times I say it's not your doctor's fault. It's just not part of the curriculum. And that's from a high level something that needs to shift. But when I was personally diagnosed, I thought, I got on Google. I'm like, you can do something for autoimmune diseases, like lifestyle wise, like what would you do, and start reading about stress and sleep and foods, and I'm like, exercise. I'm like, whoa, like my mind was blown. But I couldn't really identify like what's reputable, what's not, who can I trust, who can I not. And that's where I was like, you know what, I've always had this interest. It's just my calling to go back to school and then get that education coupled with my pharmacy education to really bring that balance between nutrition and medicine for those people who are suffering from chronic illness.
So could you talk us through, with Hashimoto's, I've obviously heard about it quite a lot, but I'm not too clear on what the symptoms are, and also what's the general, when a normal person without like a medical background, when they're faced with that diagnosis, what are they normally faced with? Like a pretty bleak chronic outlook, like it's going to be something you need to live with, or what's the general kind of traditional medical treatment?
Yeah, so Hashimoto's is a autoimmune disorder targeting your thyroid gland. So when we talk about these autoimmune disorders, it's a dysfunction of your immune system. Something is going on that's resulting in this damage that's being created to your thyroid gland. So as a result of that damage, you're starting to see a decline in functionality. And the only way you know that that's occurring is through symptoms that are then expressed by your body. And so usually, and unfortunately, by the time somebody identifies and discovers through their symptoms that they have this diagnosis, a lot of damage has been done to the point where you probably will need thyroid hormone replacement for the rest of your life. It just depends on how far along the damage is. But to slow that progression, reduce the likelihood of increasing your dosage to your medication, reduce the underlying inflammatory process in the body, that's where lifestyle nutrition kicks in. Because once you have one autoimmune disease, your chances and likelihood of developing a second are quite high. And so because what leads to autoimmune diseases is that chronic inflammation. And so if you continue this ongoing chronic inflammatory state, you will then develop a second one and a third, a fourth. I mean, I know of some that have 6 or 7 autoimmune diseases. But it's because we're not doing our part to reduce those lifestyle factors.
And so how did you, so you got your diagnosis, which, is, the irony must have been terrible for you. You just, you have a big interest in the whole world of it. And then you suddenly are faced with that issue, and it must be, the universe is acting in some mysterious ways there by delivering that to you. How did you deal with that? Could you talk us through your progression from from that point onwards, and how what you're like today in terms of your condition?
Yeah, of course. So when I first was diagnosed, it was kind of like I knew it, because I was experiencing some weight gain and my hair was really dry and I was fatigued. And so just being in the medical profession, you're like, I think this is my thyroid, because I'm exhibiting all these symptoms that I'm familiar with that are associated with the disorder. And so then so you're looking for answers. So you finally get something definitive. So you're like, okay, I knew it. Like there's something here I can work with. But then I went through a period of just shock and anger at myself, because then you start looking up, like, how does this happen? Why? And I'm like, oh, it's because I did this. And 5 years ago I did this. And I remember when I was sick. So you're going through all the years and back and almost punishing yourself mentally, like, oh, I shouldn't have done that. I knew it. If I would have known back then, I wouldn't have done this. And so that was, and you're just creating more stress. And so I did it. So I created more stress for myself and anger, and which wasn't helpful, obviously, to my disease. But then I very quickly pivoted and was like, you know what? I am going to take control of this, number one. And so at first I started reading, and okay, a big thing that I found online was, okay, I should avoid gluten. Okay, so I'll avoid gluten. So I stopped that, check levels. I'm like, I don't really see a difference. I'm not feeling a difference. I went through a year where I got pregnant. And so I kind of put everything on hold because I was like, I'm not going to do anything. I'm just going to eat normal and, whatever, just keeping my levels controlled while I'm pregnant. And then it was after I had my daughter that the new year, I was like, you know what? I'm going to go back to school. I like the little things that I've done from what I found online haven't been enough. And they haven't really shifted, my outlook on my disease and how I'm controlling it. And so I was like, you know what, I'm going to go back to school. I'm going to become that expert. I'm going to take control of my health by learning and educating myself. But at the same time, I'm going to help people by sharing my learnings so that they can be empowered to do the same. And I want to always make sure that they know that I'm a reputable source of information. I'm not providing my opinions. Everything I'm providing is backed by science. It's not hocus pocus medicine. Because, when you come from a world of conventional medicine, you start to get that look like, okay, what are you doing? None of this stuff really works. It's not real, and so I wanted to establish myself and ground that for both sides, right? For those that are on the conventional medicine and alternative, and try to bridge that gap and bring it together to realize like we're in this together. It's not me against you, but to empower people and allow them to take control of their health. I will say, yes, I now have my diagnosis, but I'm probably I'm going to actually be more confident with that answer. And I'm going to say, I am the healthiest that I've ever been because of it. And when I have a flare up, I immediately know, because I'm so in tune with my body and I know what healthy is and what I'm supposed to be feeling.
That's really interesting. There was an Instagram story today that went out and said, why would your goal be to go back to how you were? How you were was what got you to the place that got you sick.
Yeah.
You need to be, your goal needs to be to get better than that. And your goal has to be optimal health, like the better than most people in society. And I think that's such an empowering and inspiring thought to, no, screw that. I'm not going to go for how I was before. That wasn't enough. I'm going to be better than that. And that's a really, do you feel like that's a really powerful feeling to have that, be in that position now?
Absolutely. And you know what? Having the diagnosis pushes me to be better, and rather than looking at it like, oh, woe is me, I've been diagnosed, I'm just going to go the opposite direction because it's going to sadden me, it's affecting my mental health. No, I'm looking at it as it's empowering me to be better because of it. Yeah. And that's exactly what it's done. And that's what I hope for me to provide to others to do as well, and to get on that same page.
Yeah, it's really interesting actually, because I would like to say that because of the health stuff, I immediately turned around and said, I need to work on you need to do some inner work. I need to do some work. Yeah. But this condition has just flapped me about so much that I had no choice but to go and do this kind of work. And it does, without sounding cheesy, it does make you a better person.
Yes.
And it does make you more compassionate and have more empathy for people and want to help people. Can I say that I would have done something like this podcast previously? Being honest, no, probably not, because it wasn't getting me to where I wanted to be in my old life. Right. It was maybe a little bit selfish. So yeah, it's really interesting. It does kind of force you to be a better person, and then does actually bring other things out.
Absolutely.
So actually, so fast forward to today, would you say most days you're actually feeling better than you did before then?
Absolutely.
Amazing.
And I say that most days, yes. And for a long time, I was feeling great. It was actually, unfortunately, the year of the pandemic, still ongoing. But I think the shock of it and the unknown and the stress that came with it threw my disease out of control and gave me a greater appreciation for stress and the impact of stress on our health. So yeah, I would say most days I know how to handle it. But I think like this was a learning just in this year, was just the impact of that stress has on chronic illness and on our body.
Can I ask you a little bit about the fact that we've got you on the show, where you've got this unique, you're like right in the middle, like you're over kind of everything. Could you give me a little bit of information and your opinion as to what you feel like some of the main limiting factors of people getting better? So I'm talking about someone who maybe isn't, well, like I was, and maybe like a lot of people are, who are just, living their normal life, never really looking, used to going to the doctor, getting antibiotics, getting that pill, and then suddenly they're faced with this chronic health issue where you're told you've got to be on medication your whole life, you're told your life is over. What would you say is the main limiting factor for people recovering?
So like you said, what we're used to as a society is a quick fix. Okay, and so that's, you go to the doctor, I get an antibiotic, I'm better. I have high blood pressure, I go get blood pressure medication, it's better. And we're reliant on numbers and labs to tell us that we're better. And so I think when we're looking at chronic illness, and when let's say you decide you want to venture on this journey to healing, it's that realization that it's not a quick fix. And I think when people have that expectation, and then that limits them. So they may go into it, oh, I'm ready to do this. And, 2 weeks go by, 4 weeks go by, and they're like, well, I still feel the same. Like, this is not working like it would if they were on medications. And so it causes them to just kind of quit and give up on it. And I'm constantly preaching, like, your journey to healing is not a sprint, it's a marathon. And there is no quick fix. And that's the mindset we have to change. Like, when you're sick, we have a quick fix. That's not how it works here. You're sick, you have to recognize you want to get better, and you have to be willing to put in the time and the energy and the focus to do so, and recognize that it's going to take time. And I think that's, to me personally, having that conventional and functional medicine side, that's a key differentiating factor. And I think that's a limiting factor for a lot of people.
I feel like you've just fully described me. No, just the impatience I have, and the patience I've had to grow as a result of every new treatment, immediately doubting that it's going to work, and I need to. Weirdly, I would go through this phase where I would start something and I'd be excited. And then you'd be excited, you'd probably get like maybe a bit of a placebo effect that, things were going okay. Then you would have that dip. And then I would immediately start looking at something else that I could start planning in future. And that's such I'm not doing that now. I am sticking with the same thing. And the good thing about Instagram and following people like yourself and, other people, with a similar, who've been through stuff before and also have been through their own issues before, and also, medically trained or functionally trained. Right. They, consistency, that's all you ever hear. Consistency is key, and sticking with it. Do you think, is there, I'm looking a lot more these days into the deep down belief that you can actually recover, and how much of an effect that has on your recovery. Is that something that you work when you work with people, or just in your own experience? How much of a big impact does that have?
Oh my gosh, that's everything. That your mindset is everything. And so if you don't believe that you can heal, you're not going to. Yeah. So at that point, you're just going through the motions. So until you have that deep belief that yes, I'm going to get to this point, then it becomes a journey, and it's not just you checking the box that you didn't eat this, didn't do that, but in your mindset, you're kind of like, I don't know if I really believe this is going to work. Yeah. And so overcoming that, and then having that acceptance and belief that you can do it. So is, I guess, number one. You really have to believe in the fact that it can happen. I feel like a lot of people question it, and they're skeptical of natural healing.
Did you, out of interest, like how quickly were you able to cultivate that belief, or was it like something that just immediately came to you?
No, it took time. I mean, because so like I said, I'm conventionally trained, and so I don't focus on a lot of these things. But deep down, when I was going through my training, I recognize, and these are more with chronic diseases like diabetes, like hypertension, like high cholesterol. These are like kind of your chronic disease areas that you focus on, where we talk about lifestyle. And I would always say, well, gosh, like you could really, you could reverse disease. And I've seen it happen where people have lost weight and reversed diabetes, you know? So it's like, okay, we could do this on a larger scale. We could really impact that development. But never did I imagine that that was possible with something like autoimmune conditions. You know, because that's just taught like, that's it, your immune system's out of whack, it's attacking your body, and nothing you can do, you gotta take meds. And if you look at and that's just truly the mindset. And if you look at what's currently the number one drugs that are prescribed on the market, they're specialty medications targeting autoimmune disease. I mean, that's the spend, at least in the United States, on drugs. It's this area, because we're not focusing on lifestyle. And so as a pharmacist, no, I was always under the impression that it's medications for autoimmune diseases and that's it. There's nothing more that you can do. And so through trying to read and educate myself, and you know what, the power of social media to identify some key clinicians that are out there trying to do that education, like Dr. Mark Hyman, like Dr. Isabella Wentz, like some of these key people who kind of put that in my mind, like, let me dig a little deeper, like what they're saying kind of makes sense. Let me better educate myself. And, you know, just finding that there's a world of information that I didn't even know where to start. And that's why I was like, okay, let me go through a program here and get educated the right way, because I'm now really believing in this. And it is, I truly believe it's that connection power of social media that allows us just recognizing what's truth and what's misinformation.
Yeah, definitely. It was actually, in terms of going back to that, the belief, I remember reading something once that said, you know, when someone is terminally ill and they're given, you know, they're saying, you know, you've got 3 weeks to live, then invariably they live for 3 weeks, because they've had there's something in their mind that expects that they're going to live for 3 weeks.
Yeah.
And it's interesting that I remember reading that and I thought, wow, at that point, I've been told by almost every traditional doctor that this is just going to be something I have to deal with and I have to live with, and there's nothing I can do. So when you're told that so many times by someone in a position of influence, that just tends to be expectations. And I guess every time you're told that, it builds up another wall and another wall and another wall.
Yeah, absolutely. Yeah. No, that's absolutely true. And I, you know, I did a post recently on my page, and I said on it, healing is a mindset. And that's the truth. Like it's up to you. Your mind is powerful. And like you said, like you've given an end date, and that end date happens because that's in your mind. Like your brain is so powerful, and it's connected to the rest of your body. And the belief that you can heal is what's most empowering to somebody.
Yeah, definitely. And to talk us through, so how did you come up with something I really like about your story is that, and it's something I've done on a far smaller scale, is that I decided a while ago that I was going to try and help people when I recovered. And then someone said to me one day, why are you waiting until you recover? Start doing it now. And I was like, yeah, all right, that sounds, I wanted to do it when I felt better, but then I was like, well, actually, it might actually help me. And what I feel like it was quite a courageous decision from you, a lot more than me. I'm just doing a podcast, to actually start that. You were going through, you know, what you're going through and learning. Was there any part of you that just thought, I'm going to wait until I'm completely better, then I'm going to start doing that? It's just you started it at that specific time you actually got trained.
No, I didn't. No, I didn't want to wait, because I was implementing the things that I was learning in my healing journey. And I realized, again, that connection is that I'm going to connect to like people, and I'll learn from them as well. And so I've learned so I might put something out there that's factual. However, I learn when I get those comments back of the patient's experiences, I learn even more, right? And so that was my thought of, I'm going to give them, but they're going to give me. And so it's a give and take, and we'll learn from each other. And I just felt like it was important to be very almost like truthful in saying, like, this is me. Like, I'm not coming at you when I'm perfect and I've been healed. I'm coming at you as I'm going through the journey, just like you would be going through the journey. And so it was very important for me for people to realize, like, I've been doing this now for almost 3 years, and it's taken that long, and I'm still not 100%. There's still things I want to do better, and I'm still working on those, and I'm still going to talk about those with you. So it's almost like I'm a real person just like you. I'm not just another doctor that's giving you information.
How did your what you went through, how did that affect relationships in your life, if it did, and if it didn't really affect relationships for you, how do you see it affecting relationships with people that you work with?
Yeah, so I mean, fortunately for me, I have a very understanding family and circle around me that was very supportive and recognized that maybe the symptoms that I was feeling, now it made sense. Or the way that I was acting or behaving or the moods or whatever. And so it was, I think the support grew from that point because, and I do come from like a medical family and circle of friends. So I guess that makes sense. But they did question the whole lifestyle implementation of it, like, oh, now you're going gluten-free. Like, that's just a fad. Has nothing to do with your thyroid. So I got a lot of that. And that's really was like, okay, you know what? I'm just going to get truly educated, because I can repeat what somebody put on a blog, but like coming from a family that's deep in science, they're constantly questioning why you're doing this and if it makes sense. And I finally gotten to get everybody on board and have been able to impact their lives somehow, some way through lifestyle and nutrition to where they recognize and see the benefits of what I'm preaching. And so I feel like that's a win for me. But I can see where with others, there can be that lack of support. And that's a challenge, obviously, and that hinders your healing because then everything you're doing remains questionable. It's not, you don't have someone or somebody to lean on in those times where you're not up here, because it's a roller coaster ride. And so, yeah, I mean, those are definitely challenges that people have to face.
That's why I feel like this, people listening to these kinds of conversations and following people like yourself and people just with positive message that you can relate to is so important, just because invariably people who are going through chronic health issues in their own circle, they will probably be the only one who's going through that particular thing, and no matter how much of a close support network they have, they can never truly understand what it's like. And I think that's, for me, the most difficult part about it, relationship wise. And so you have to have a strength to get through it yourself, but also a strength to not feel completely isolated from people Does that make sense?
Yeah, absolutely. Because people don't understand, and they're not going to understand it unless they go through it themselves, which is that struggle, unless they're open to understanding. And I think that's on us, in addition to trying to heal ourselves, is to ensure we're educating and a lot, like, just informing those around us of what it is and what is the struggle, and like getting them to understand it. I mean, that's a whole other challenge in itself while you're just trying to heal. So it's hard.
The way I kind of see it, and it seems to be, people who come on the show who say they've lost friends throughout the years. It's almost like a filtering out process.
Yeah.
Get rid of people that wouldn't have been good for you anyway.
Absolutely.
If they're not prepared to like stick around or understand your lowest times, then they don't deserve to be your.
Exactly. And that's where people's true colors come out, is when when you're at your lowest point, then you know who your real friends are.
Exactly. It's really interesting what you said earlier about well, I say interesting because it resonated with me a lot when you said that you immediately started looking back at mistakes you'd made in the past and how that could have led you to the position you're in. And that for me is just so true. I just immediately, and still I try to stop myself from doing it now, just look back to my 20s, how I treated myself health wise, partying, food, just a toxic way of living. But the way I would then get into the victim mentality of like, well, everyone else was doing it and they're able to live their life fine now, and it's not fair, and you just start going in this cycle. Was that the same for you? Was it kind of like that cycle of like regret, but then also playing the victim?
Of course, yes. Like, why me? Why am I the only person that has to deal with this? And coming back when people say something, well, you don't know how it feels to have a thyroid condition. Like, this is what's hindering this or that. And of course, yes, it's that looking at others, but you get past that. You can, because I have, and I'm just like, it is what it is. I mean, there's always those moments for sure where, you kind of go back to it. But then if you make something positive of your disease, and you like take it into your own hands to heal, then those moments are like few and far in between, and you don't have those thoughts as much.
Definitely. And in terms of like, I guess going back to your lowest points in the first year or so, where you said earlier you were doubting things and you came from that traditional medical route, and you really need to make a bit of a transformation then. How did you talk yourself round mentally to get in the right frame of mind to kind of push on to that level of healing that you needed?
Yeah, so I'm always one that has to know the reason why. And so in everything that I do, I'm always like answering the question, but why? So that's what I did with this. And so it was like, you're diagnosed with Hashimoto's, and my initial response is, but why? And so because of that, but why, led me to start researching and identifying and understanding. And once I got that basic understanding of all the things that it could be, it was like, okay, now I'm going to own it. Like, I know why. I think I know why. I think I figured it out. Now I'm going to own it, and I'm going to fix it, and I'm going to be the best version of me. But that's just how I function. So by personality, I'm a fixer. That's just who I am. Like, you give me a problem, great. I'm more than happy to fix it. And so that's kind of how I took on my own health. It was like, viewed it as a problem, and I'm going to fix it. Yeah.
And it's good, and that's like a common theme I hear from people who have recovered. They take control back from the. Obviously, it's a bit of a weird mix, I guess, and a fine balance to strike, because you've got to let go to a certain extent, because you've got to accept that this is happening and not. Yeah. Which is. I struggle with that massively, but then say, screw that, I'm taking control. I'm going to be the one I'm not going to let anyone else decide how quickly this goes, and et cetera, et cetera.
Right.
Did you find that balance of letting go and accepting, but also taking control quite difficult, or was that something that came quite naturally?
Oh, of course. I mean, I'm making it sound like it happened overnight, but it took time. Absolutely, to like accept it, understand it, and then finally come to that point where I'm going to take control. And like I said, so I was diagnosed in 2015, and I went back to school in 2018. So there was a period of like trying to wrap my head around it, educating myself on my own, getting pregnant, having a baby, and realizing what that means to my disease. Like, so I went through a lot of phases until I finally came to the new year in 2018 and made this decision to, really take control of my healing and go back to school.
To someone so normally I ask I guess, like, from a mindset point of view, to someone who's really struggling right now, who's kind of in the depths of, of their mentally in the depths of their illness. Like, what would be your advice to them? And I normally ask from a mental point of view, but actually I'd like to know from a practical point of view, just on a general level, like, what would you suggest for someone to do, both kind of from a mental point of view, just giving them advice, but also, what's the first couple of things you would do, like going back to where you were, like what you know now?
Yeah, so the first thing, if you're struggling with an autoimmune disease or chronic illness, is recognizing who that practitioner is that you're working with. Do you trust them? Do they understand the healing approach that you want to take? And so if you're seeing somebody that's strictly based medicine and that's it, that's going to impact your healing journey. And you're not going to feel like you have that support that you need. So I think finding the right practitioner, clinician that you're going to work with, that you can trust, that you can open up to, that you can ask questions to, that's important. And so that's my first piece of advice. Because I went through that personally myself until I finally found the right person. And I felt like, okay, now I'm feeling good. This person gets it. They see both sides and they're not limiting me to just, hey, go take medication. And so I think that's, especially if they just shut down your questions or disregard them, like that's not allowed. So do not allow that. Yeah. So finding that right person, is kind of the first step. And then like my husband always says, how do you eat an elephant? One bite at a time. Kind of the same concept, like this is like one step at a time. You're not going to get better overnight, like I said, and recognizing what is it that I need to mitigate. Is it stress? Okay, can I look at my life and be like, what can I do to mitigate stress? Am I sleeping well? I mean, most will tell you no. Like, do you get 8 to 9 hours of sleep? Probably 90% of people will tell me no. So maybe you start there, like small wins that you can do to like help your body feel better. And if like nutrition and diet seems like way too much, then save that to the end, like focus on your stress, focus on your sleep, movement and exercise, breathing techniques, things that you may not think are helping in the healing journey, but they are. And so identifying like, what are all these interventions that I can take on? What's the easiest that I can start with and build from there? Because once you have that immediate sense of empowerment that you're doing better, you're going to want to do more. It's just a natural approach. But then also recognizing that's not going to happen overnight, and that takes time in and of itself. And so it's kind of like creating that balance between your expectations, and really just being realistic with them in terms of what you can do and how quickly they will be accomplished.
God, I don't think I've had between 8 and 10 hours sleep since I was probably at university, and that was probably alcohol induced at the time. I so agree with finding the right person. I think maybe in the past I rushed to just get someone because I was so desperate, and it's almost a bit like, that sounded a bit strange. It's a bit like dating, and you should actually take time and maybe almost interview a few people and
absolutely
get the right person. Do you think there's a rise of, maybe I just wasn't looking hard enough, but the people I worked with in the past were people who were initially medical doctors, and then I realised I didn't want to do that. I wanted to work with more naturopaths. But a lot of these naturopaths hadn't been through chronic health issues, and I don't feel that I could connect with them emotionally. And what I mean by that is, I always felt that in the back of their mind they were doubting something about what I was saying. And now working with someone who has been through it, and like yourself, there's just so much more of a connection there, and I don't feel there's any judgment. And I know maybe the word judgment sounds weird, but I think you, particularly from a male point of view, when you're not used to telling people that you're weak and you've got all these issues, you are being more vulnerable than you ever would. And so if you can do that without any judgment, it's so powerful.
Absolutely.
Is that a thing? Do you think there's an increase on the people that practitioners who've had health issues and are going into kind of thing like yourself?
Yeah, I definitely think so. And I think it's because the realization of, oh my gosh, I'm diagnosed. I thought I was otherwise healthy, and why is this happening? And so like I said, when you start asking that question, why, as a practitioner, you dive into deep into the research and the literature, and you're like, there's a lot out here that I was never taught. And so it kind of takes them down that path.
Yeah, it's something like, I think Tony Robbins said something like, find the person who's done what you want to do and replicate that exactly. And there's no better way of doing that than becoming their patient, because they can tell you exactly what to do. So that's really cool. Like looking back on your journey now, like leading up until this point, obviously your career was very much on a medical trajectory. And so had you not had, correct me if I'm wrong, had you not had your diagnosis, your life could have gone in a completely different direction. What are the ways, if any, hopefully some, that you say your life is better as a result right now?
Well, I mean, for one, it's the knowledge that I've gained and that I probably would never have gone down this road of learning and understanding had this diagnosis didn't push me to do. So it's absolutely better from that sense. But then it's also that ability to give back, and to give back on such a large scale because of social media. I'm like so thankful for that. Because I'm impacting so many lives more than I ever would have been able to if I was just one-on-one communicating with them. And who's to say they were ever the right people that I was going to impact? But now it's like the people who follow me choose to follow me because they want to, which is great. And so that means whatever I'm giving to them is what they want. And I'm impacting their lives in that way. So yeah, I guess it's twofold. It's the finally being able to gain that knowledge and then to give that knowledge away.
Does it, the fact that we spoke about it before we came on, like this is something that you're building as, something you will do and are going to do full time. So, working for yourself, like previously, were you working for yourself? Did you have your own business? So, I mean, the same things happened to me, and I hate kind of relating it back to me, but there's just so much more, relevant points. And I never saw myself as an entrepreneur until I was forced to look at myself as an entrepreneur. And is that the same for you?
Yeah, absolutely. And then there's always that fear of taking that first step, and when I started, I still, that was never the plan. It just grew to that. And it's almost like, it's forced me to do that. And it's a wonderful thing and a wonderful experience to realize your capabilities and to realize that you can do that.
Yeah, it's amazing what you're capable of when you're kind of, you're up against it, your back's against the wall, and you've got to swinging. So yeah, no, I love that. Cool. Look, thanks so much for coming on the show.
Yes.
Really appreciate it. I think you've covered some really interesting subjects that covers, as I said, like those 3 different areas. If people wanted to reach out to you, either to work with you or just for any advice, like what's the best way of them doing that?
Yeah, so you can follow me on social media on Facebook and Instagram under Dr. Autoimmune Girl. Also on my website, you can subscribe to my monthly newsletter and check out my blog there at DrAutoimmunegirl.com. But yeah, that's the best way to stay informed. I have a lot of things cooking up to help people even more. So that's where I share it all out.
Awesome. I love the Instagram name, by the way. I was surprised that wasn't taken. I think it's a cool, I think it's a cool, it has like a positive ring to it as opposed to, a really serious, like.
Yeah, I got to keep it fun. Otherwise, what's the point?
Exactly. And look, thanks so much for sparing the time. I know you're really busy and you've got a lot on. So I think, you're going to help so many people today. So I really appreciate it.
Thank you so much. It's a pleasure.